Another central nervous system drug is antidepressant. Drug treatment of depression is based on increasing serotonin 5-hydroxytryptamine or norepinephrine or both the 5-HT and NE at synapses in selective tracts in the brain. This can be accomplished by different mechanisms. Treatment takes several weeks to reach full clinical efficacy. There are 5 classes of antidepressant drugs, and these are: number 1 is tricyclic antidepressants. Example of these drugs are doxepin, desipramine, amitriptyline, imipramine, and protriptyline. Number 2 is selective serotonin reuptake inhibitors. An example for this are fluoxetine, paroxetine, sertraline, fluvoxamine, and citalopram. Number 3 is serotonin norepinephrine reuptake inhibitors. Example for this are duloxetine and venlafaxine. Number 4 is monoamine oxidase inhibitors. Example for these drugs are tranylcypromine, phenelcine, and selegiline, or what we call as monoamine oxidase beta selective. There are 5 miscellaneous antidepressants, and these are bupropion, maprotilene, mirtazapine, trazodone, and St. John's wort. There are 8 contrasting mechanisms of actions of antidepressants, and these are: number 1, tricyclic antidepressants inhibit reuptake of norepinephrine and 5-hydroxytryptamine. The inhibition of reuptake leads to a sequence of events that eventually results in an antidepressive effect. Number 2, selective serotonin reuptake inhibitors inhibit reuptake only of the 5-HT, or what we call as 5-hydroxytryptamine. Number 3, selective serotonin reuptake inhibitors inhibit reuptake of norepinephrine and 5-HT to varying degrees based on concentration. Number 4 is monoamine oxidase inhibitors. The non-selective one inhibit the metabolism of norepinephrine, dopamine, and 5-HT in nerve endings. Number 5, mirtazapine increases the release of norepinephrine and 5-HT from nerve endings. Number 6 is bupropion increases the release of norepinephrine and dopamine. Increasing dopamine in the synapses may contribute to its action, especially in its use in smoking cessation. Number 7, trazodone blocks 5-HT2A and alpha-1 adrenergic receptors. And number 8, St. John's wort reduces the membrane potential of nerves and may indirectly reduce uptake of norepinephrine and 5-HT. Most of these drugs are lipid soluble, have long half-lives, and are metabolized. Adverse effects of these drugs are as follows. Tricyclic antidepressants are very likely to cause xerostomia. Xerostomia is defined as dry mouth resulting from reduced or absent saliva flow. Amitriptyline is especially potent in this regard. Monoamine oxidase inhibitors should not be used with agents that release catecholamines and serotonin. Monoamine oxidase inhibitors should not be used with other antidepressants. Adverse effects of antidepressants are compared to the degree of sedation, seizures, hypotension, cardiac effects, nausea, vomiting, diarrhea, and antimuscarinic effects. Tricyclic antidepressant drugs are positive to antimuscarinic effect, high to sedation and hypotension, moderate to cardiac effects, and minimum to seizures, nausea, vomiting, and diarrhea. Selective serotonin reuptake inhibitors are enhanced or have a positive effect on nausea, vomiting, and diarrhea, and there is no effects to sedation, seizures, hypotension, cardiac effect, and antimuscarinic effects. Monoamine oxidase inhibitors are positive to hypotension, minimum to seizures and nausea, vomiting, and diarrhea, and there is no effects to sedation, cardiac, and antimuscarinic effects. Miscellaneous agent like trazodone, is positive to sedation, moderate to hypotension, minimum to seizures, nausea, vomiting, and diarrhea, and there is no effects to cardiac and antimuscarinic effects. Bupropion is moderate to seizures, minimum to hypotension, and there's no effects to sedation, cardiac, nausea, vomiting, diarrhea, and antimuscarinic effects. And the last miscellaneous agent is duloxetine. This drug is minimum to sedation, hypotension, cardiac effects, and there is no effects on seizures, nausea, vomiting, diarrhea, and antimuscarinic effects.